On an RX check, where a patient's coming in complaining that they cannot see very well out of their glasses, the staff will pull up an RX check, and the tabs again are very small. You've got the summary page, which is exactly the same as the previous summary page. The anterior segment, sometimes there's something wrong with the front of the eye or posterior segment, and you need to make notations of that. These look exactly the same as they do on the comprehensive. The only two that are different is the RX chief complaint. You can see that the RX chief complaint is simply just a complaint box. Clicking on here, distance blur with glasses, so I would just type distance blur with RX. Remember, hit tab so that it throws the information here, otherwise it won't save. And the plan tab looks like your other plan tabs. So I would just click on add, click in the diagnosis, RX check. In the assessment I would write over minus, plan, I would write remake, RX, follow up if needed, save, and then sign off. A cataract post-op exam has these tabs. You've got your summary, medication tab. What's different is the post-op tab, refraction tab, anterior segment, posterior segment, plan, codes, and PQI. You've already seen all these tabs. The only different one is post-op. We'll click on that. On the post-op tab, you will see a lot of familiar boxes. Basically, the most important part is in this upper left-hand corner is the number of days of post-op, medical compliance, and the type of lens. That's what these questions are. Unaided acuity and aided acuity, and unaided near vision is right here. We take unaided near vision on premium IOLs. Your pressures are down here. Keratometry readings are at the bottom if necessary. You've got your chief complaint right here. Again, remember, hit tab or the data doesn't save. Who the surgeon was and surgical history and date of surgery. That's important for billing insurance, any glare testing. Over here on the far right, what this says is additional tests for premium lenses. So if someone has premium lenses and you're doing additional testing, you need to put it in this box. This box right here says additional tests for premium lenses. So when the patient has a premium lens and you're doing additional testing, you'll put it in this box right here. The final one to show you is a communication layout. The communication layout is very basic. You have your summary and a plan. The only difference is the communication. What a communication tab is used for is anytime you want to enter information but don't want to enter it on an exam record. Say a person had an exam 2 weeks ago and today you had a phone call with them and you want to document that. Well, you can go back and edit your records and add that in, but that looks bad. It shows that you've changed the data from 2 weeks ago. What you should do is just add a communication tab. Advanced directives is right here, and that's if you're telling the patient to do certain tests. I really don't use this section. The bottom portion right here is just that you've signed off on the information. So really what you use is the upper section right here. So I'm going to add. So what I typed in is called patient, redness has decreased, and patient is feeling better. Over on the left, you can type who you spoke with, patient, the relationship, the method that you spoke to them. Then hit save, and then sign off. The information that you put in your notes will not show up in this upper section. This is not the chief complaint. This is just a method of communication. If you didn't fill out the information down here, it won't propagate up here, but you still have the communication of the notes right here, and this will print out on a record if necessary. And down at the bottom you can see where you had signed off with your date and time. Remember, when you're done for the day, you want to go over to the right to where it says log off. Don't hit the X, go to log off, and that will take you back to the main screen to log back in. Well, that's a summary of CompuLink. I know it was quite detailed, but I'd rather you watch it on a video than to have to walk in the first day and just have it trial by fire. I want to thank you for joining our company. I hope it meets your expectations, and I will try to do everything I can to make your work environment here enjoyable and productive for you. Good luck to you, and remember, I'm just a phone call away. Have a good day.